So welcome, and thanks for chatting with me about Jumpstart Psych and the Psychotherapy Essentials program. Just for everyone listening, my name's Dr. Geoff Talis, and I'm the co-founder of Jumpstart Psych. I'm an integrative psychiatrist and psychotherapist. And Andrea here is one of our former and current students. And so I'll let her introduce herself. Go ahead, Andrea.
So I am Andrea Witham. I am dual certified as a family nurse practitioner and mental health nurse practitioner. I currently own a practice in Southern Oregon. It's general practice, but I do enjoy working with healthcare providers, first responders, law enforcement. That's kind of the type of clients I seek to serve. And I also really have a passion for prevention. And so I gear a lot of my practice towards educating others on how to be proactive about their mental health, preventive about their mental health. So, yeah.
Cool. Yeah. So welcome, and thank you for taking the time out of your day to do this interview. So you I think you gave us a pretty nice overview of where you are and specifically who you're treating and all that. This question is about taking it back to before starting the Psychotherapy Essentials program. Could you tell us a little bit about like what it was that was motivating you to find such a program, and like what kind of problem you were trying to solve that you were experiencing?
When I first started, so I've been a mental health nurse practitioner for 2 years, and I started at a private practice where I was really building a caseload. And I found that a lot of people would come in and they're not just looking for medication management. They are wanting medication management and psychotherapy. And they really want to be able to do that all in one place. Some benefits of that obviously are taking less time off from work to attend appointments. You're kind of doubling up on your appointments. Also, I'm insurance-based practice. So, with each appointment, people have either a copay or a co-insurance, and being able to really go to one provider and that's able to be holistic and meet all your needs. That's really what people are looking for. And I get asked that all the time. So that was one reason. The other reason is I did do my mental health nurse practitioner certification through a post-grad certification. And while we did have a psychotherapy course, we had a lot of didactic, but there wasn't really a lot of opportunity for the experiential and the case consultation portion of it. Even in the private practice that I started in, we had therapists there, and they were more than willing to answer questions when they had the opportunity, but oftentimes they were supervising their own therapy students. So I was really just kind of looking for more of that experiential education, a place where I could actually staff real life cases that I was, seeing and stuff. Yeah, so that's kind of what I was looking for. I had also, when I initially got out of school, I had, of course, signed up for a few different therapy courses. A lot of them were online modules. You watch the module and then you try to apply it yourself, and you don't have that actual person that you can ask questions of. It's more just pre-recorded. So I didn't find those all that helpful, even if they were, really good courses, so to speak, or the person that came up with that therapy and knew all that they know about that therapy. If you didn't have that ability to ask questions about it, it just didn't seem like it was very worth the money that I was spending.
Yeah, so you actually took other therapy courses and found them to be underwhelming in what happened afterwards. So something that was really important to you was that back and forth and being able to get live feedback and being actually an active member of the learning process, as opposed to watching a video and not doing anything else with it.
Yeah, I would find that I would listen to those and go through the modules, but then I wouldn't really apply it in my practice. So.
Yeah, it would just be something that you would just listen to and find, oh, that's interesting, and then kind of just move on. But so what you're saying is that the Psychotherapy Essentials program, you felt that was something that we added that other programs didn't have.
Yeah, I was really drawn to it because it did with each module offer not only that didactic portion, which I think is really important, but then we also had like the experiential portion. And then we also had the part where we were able to like bring cases and then apply from that type of therapy, how we may approach it, or, what we could be doing differently within
Right.
it.
Yeah, like it sort of guided management and treatment planning and even prescribing too.
Yeah,
Mhm.
absolutely.
Yeah, so you ended up choosing Jumpstart Psych and the Psychotherapy Essentials program because there just wasn't anything else like it, especially for prescribers and with this live component too. So I can see, I mean, that's really, why we started the business is because there was such a need for actual mentorship and support. So that's exactly the gap that we were trying to fill. So I'm glad that it was helpful for you, Andrea. Thank you for that.
Yeah. No, thank you.
So you took the program and you also decided to the Psychotherapy Essentials program, and you also decided to do ongoing supervision with us. Can you sort of talk about why you decided or how you decided to do the additional supervision component after the Psychotherapy Essentials program was done?
Yeah. I do think that was also another part of why I was drawn to that program, is that I did see that it could lead to ongoing supervision. I work in a full practice authority state, which is amazing. I love it. But just because I do have full practice authority and I'm not required to have a supervisor or collaborator, it doesn't mean that I don't know enough to know that I need that, right? You always hear, like, if you are providing therapy to others, really, you should have ongoing therapy supervision. You should probably also have ongoing therapy yourself. And so I just thought it was a really important part of it. I also think too, it was one of my own preventive measures for my own mental health, to have that in place as I embark on, this practice of mine and stuff like that. So
Yeah.
I really saw it as a benefit.
Can you say more about that as it relates to your own mental health and being part of the group?
Well, yeah. So, we do a hard job. That's it just is what it is. Some days you come in and you literally absorb everything from everyone. And that can be really heavy some days. And there's other parts of that too, where a lot of nurse practitioners, and I think providers in general, but I'll speak to the group that I'm a part of, that we oftentimes will experience imposter syndrome, especially when we're first starting out. And I think by having that supervision in place, you get that feedback. By taking this course, you feel like you have that strong foundation, and it can help to provide evidence to challenge that imposter syndrome, I guess.
Yeah. So you have the evidence. You're like, oh, I've taken this program and I totally know how to implement it now. And now I can continue to get that live feedback that was really attractive for you, just to be on top of things if they come up, as they come up, which inevitably it does.
Absolutely.
Yeah,
Absolutely.
and especially with the population that you work with, you said law enforcement and a number of other types of people. So I'm sure trauma has a lot to play in there, and family dynamics. really difficult real situations that you're facing on a daily basis with these patients.
That's one of the reasons that I do enjoy working with these populations, like other healthcare providers, nurses, because we help people, we're caregivers, but we're also human and we need that for ourselves. And unfortunately, there is there are higher risk of experiencing mental health issues with these professions. There's a higher risk of people dying by suicide. And that's just not something I want to see for my colleagues. But at the same time, I know that I need to be prepared for whatever, and having that supervision, having that support in place, that professional support in place, is only going to help me should the situation arise.
Yeah, yeah, that's really powerful. I want to go back to something you brought up, which is the need for supervision, and being that you're in a state that doesn't require any collaboration officially or supervision from a physician, you still see the benefit of processing and discussing cases, no matter how easy or difficult, whether they bring up something that's relevant to yourself as a person, or if it was just a difficult situation for them, period. It still has a very strong emotional impact on you. So to have a group that you can go to that's safe, that everyone understands the situation and what everyone's going through, it's in a way healing for you to know that other people are experiencing imposter syndrome, also having difficult times with difficult cases, and it normalizes all of this difficulty. So in a way, it helps you come back to work stronger and more prepared to handle that emotional burden.
And I'm not required to, which in a way I think is a benefit to me, because then I get to seek out and pay for the supervision that I think is valuable and helpful. I was just listening to a podcast the other day, and they were talking about medical supervision and the benefits of it, but only if certain things were met within that supervision for it to be beneficial. But like feeling connected to your supervisor, the supervisor wanting to be there and wanting to teach, supervision, whoever's supervising you, getting to know you, and really meeting face to face, having those conversations, it actually showed that there's a lower risk of burnout within healthcare providers that have good supervision. So, again, I don't want to burn out. I still have a few years to work.
For sure. And you know what? So another thing you brought up, and I'm going to come back to avoiding burnout. You brought up that although you're not required, and as a nurse practitioner, this is something that you want to do for yourself for burnout reasons, but also because you want to provide high quality care. Physicians, especially in psychiatry, it's having a supervisor is not uncommon. And so even for physicians, having supervision, especially for psychiatrists who are doing psychotherapy along with the medication management, it can be a heavy load. And which is actually another reason why most psychiatric clinicians default to just prescribing medications, because doing the therapy part is so difficult for everything that comes up emotionally, comes up individually for each clinician. It's a lot to wrestle with, and when you don't have an outlet for it, you just default to the easiest way to go, which is, oh, you're feeling sad, let's increase your Zoloft. It just oversimplifies the issue. And I think that's also something that you're speaking to about the Psychotherapy Essentials program, is that doing learning psychotherapy and being able to actually incorporate it into your practice all of a sudden makes your practice easier. But rather than me filling in this gap or this question, how have you found the Psychotherapy Essentials program to have impacted your practice? In what ways do you feel like it's changed things for you, if any?
Yeah, I mean, for one, I feel that just approaching therapy with patients, I am more organized about it. I feel more confident with it. I think I see more of my value as well. Because I think before the course, I would be doing some of the right things in the sessions, but I wouldn't feel like I was doing anything. I don't know if that makes sense.
Yeah,
So
so you felt like you may have been oversimplifying it, or you just felt a little unsure, kind of that imposter syndrome you were talking about.
yeah, yeah,
And so with the repetition of meeting with us on a regular basis, that continued to give you evidence to support that you're thinking about it in the right way, or you almost got it but do these little tweaks, and then you go back and test it out and try it again and come back and say, oh, I did that thing and it worked and it was really cool.
yeah. I think just having like, the whole
Yeah,
framework for it,
yeah, a framework for each modality, but it
it really
arises from the
just
supportive
kind of,
psychotherapy.
yeah, made me feel more confident and again, kind of more organized within my sessions and the treatment that I was providing for people. So,
Yeah, so having a more structured framework for something as ambiguous as psychotherapy, especially as someone who's primarily trained in prescribing medications, and the medical management in psychiatry, now you're incorporating the therapy part, which is, far more subjective. So integrating that structure for something that's so subjective and ambiguous for, someone of your training has been really helpful.
yeah, yeah. And honestly, I probably would have found it helpful when I was doing primary care as well. I mean, obviously there's less time, but just even having the knowledge and the framework of like in the supportive therapy and the motivational interviewing and stuff, the way that you guys present it, I it just makes me go back and think of like, people that I saw when I was doing primary care and how I probably could have been, more effective in certain areas and stuff. So yeah,
Yeah, so even as a primary care NP, this would have really supported you in being able to support others.
absolutely. Yeah, absolutely.
That's remarkable. Yeah, and it's almost like, wow, if only I had knew this when I was speaking with this person or that person, like how would our interaction have changed, or what could they have taken away from that?
Yeah.
And speaking about that, do you have any success stories with any of your patients on the top of your head that you just are grateful that you took the Psychotherapy Essentials program, like an interactions that you've had that otherwise wouldn't have been possible had you not started working with us?
Yeah, I think, and I would call it a success in the terms of maybe my awareness. So, and we just spoke about this at my supervision last week. So, um, but really, we did a whole module on transference, countertransference, and everything like that. And that really is a big piece of supervision that you get when you do the ongoing supervision. And I had someone come in and basically complain about something that I had said to them and that I had made them feel a certain way. And immediately in my head, I got really excited because I was like, yes, this is me. This is going to be a breakthrough. We're going to work through this. This is awesome. And I think had I have not taken your course, I probably would have gotten defensive. Of course, that I think is where the growth and learning really occurs. Because if somebody, going back, if I was doing primary care, I was working in urgent care, somebody complained about me or complained about something I did or whatever, like, you get defensive, right? Um, but that's really not helpful for either one of you. And I think this course and the ongoing supervision has really allowed me to be aware of that and to have that reaction when it did come up that like, okay, I can work with this.
Yeah,
Yeah.
what's remarkable is you said that someone was complaining to you about you and what you said, and rather than going down this unproductive path, you got excited that you were like, yes, I'm totally going to win this person over. We're gonna transform things. And how did that interaction work out? Was it something that you had imagined with all that excitement, the outcome?
Well, yeah, I mean, one, I think it showed that, there really was therapeutic alliance there because they felt safe enough to tell me that. But it did. And the person even had said, this was like, I went home after that session. I was quitting therapy. I did, I was done. I was going to call and cancel my sessions, but here I am. And so I think in that way, it was a success because this person is still, giving therapy a shot. And
So they're still working with you?
oh yeah, yeah,
Yeah. Wow. And even such a big smile. It's like
yeah,
they're still working with you too.
yeah, yeah, yeah. No, like I will say this, I love doing the therapy part of my job. I love being able to offer that because I feel like you really do get deeper connections with people. It's not these 15-minute in and out. And so, I think that's good for me too. I spent 12 years working in the ER, turn and burn, turn and burn, turn and burn, and you become detached from people because you have to, in a sense. And I became so detached that, enter burnout. Hello.
Mm.
And so I feel like this has really allowed me to become part of the human experience again, in a sense.
It's grounding for you to feel connected with another
Yes.
person and know the psychological um obstacles, but also, green grassy fields and beaches and beautiful views of the relationship as well.
Yes. Yeah.
Wow, that's really powerful. So burnout has really almost followed you for many years already. So no wonder you were really looking for how can I stay grounded doing all this work.
Yeah. I mean, it's definitely not a secret that I was burnt out at different points in my career, for sure.
Yeah, I think a lot of healthcare workers are burnt out, and something that really is important that you said earlier is that the work that we do is really hard, that it's a big load to carry, and you acknowledge that. And whether someone's going to acknowledge it or not, the burden is heavy, however you're dealing with it or not. And whether you know about transference and countertransference, it's happening regardless of whether you're aware of it or not. So it would only benefit people to know about it, to be aware of it, so that they can have those moments of those aha moments when a
Yeah.
patient says a very certain type of thing, and you feel calm and relaxed and even confident knowing that you have the right words to say to express your attitude, to contextualize the situation for the patient and strengthen your therapeutic alliance and build on their coping skills, and provide them reassurance, further strengthening your relationship. So
Yeah.
that's really powerful. Thank you for sharing that.
Yeah. Yeah. Well, like I said, I think this is why people need supervision. Yeah.
Yeah. So let's see, what else can we get into? Um, so what kind of advice, actually, you know what, before we get there, what makes you happiest about working with Jumpstart Psych?
I think it's the connections I've made, to be honest. Uh, like every other Tuesday, I have my supervision hour. I get excited. It's blocked on my schedule. I'm like, yeah, I get to go do supervision today. But within that, uh, there is one nurse practitioner that not only that I was in the main course with, and now we're in supervision together. And, we've been able to connect outside of the course and outside of supervision. And really, that's been a good being able to connect to others. like that, because private practice, it can be pretty isolating at times. And so building the community, honestly, I know if I ever have an issue, I can text you, even though you're not my direct supervision at this point. I do know that I feel like if I had questions about something, I feel like I would be okay to text you and you respond. And I think that's great, so.
Yeah, just knowing that you have people in your corner that get you, that are there for you, it just changes your whole attitude. You, like you said, you get so excited to have supervision hours blocked off in your schedule, and you're so enthusiastic to see people that you really connect with at a very deep level. Not that we all know everything about each other in our personal lives, but that we share the same appreciation and respect for the work that we do and the depths that we would go to help people, and what kind of a toll that takes emotionally. And yes, Andrea, I am always available for you. So I'm glad that knowing you can reach out to me anytime is something that helps you get through the day at times. That's my intention.
Great.
And speaking about that, something that all of us at Jumpstart Psych do is in our teaching, we actually model attitudes and really the entire program to how the therapeutic approach between you and the patient. So the way that we relate and the way that we convey information is very similar to how you would work with your patients. So it would be also natural for you to sort of like have us in your back pocket. Like, when this patient came up, maybe you thought of Doug Opler, maybe you thought of me, or maybe you thought of Gilly Chechel. In that moment, and you said, "Oh my gosh, I remember exactly what Doug was saying in the program. I remember exactly what Gilly and Geoff were saying in the supervision program, and I'm going to use exactly what they said." So it's like we're with you all the time in that respect, because you're just seeing so many people and so many patients, and you're constantly using these skills. So that's another way that you stay connected is, we've drilled it into your head and now you just know it by memory. And then it's also a plus that you actually like us and that, you have a pleasant feeling when that moment arises.
Yeah.
That's cool. Yeah, that's really nice to know. So is there anything, any advice that you would give any nurse practitioners who are thinking about joining the Psychotherapy Essentials program and group supervision?
Yeah, I would just say that if you've taken other therapy courses before, this is something that's going to be completely different. And I think the difference is that it's going to be much more valuable in terms of how much of it you apply within your in your practice. I think everybody should have supervision in this line of work. I kind of feel for some of my colleagues that work in other states that aren't full practice authority and they're required to have supervisors or collaborators. And the only reason I say that is because I also hear stories that they pay a lot of money each month to have a supervising physician or a collaborating physician. They may never even speak to them in person or meet them for that matter. And I don't think that that's productive, but a lot of times they do what they have to do so that they can practice. And, I think that any money you spend beyond that is, you want high yield from it, right? And I think this course and this ongoing supervision is definitely high yield. And I think it's absolutely worth the cost of the course. And yeah, I think that's what I would advise,
Yeah, it's really heartbreaking and also infuriating that there's nurse practitioners in the country, in this country, in their respective states, that require a collaborator and regular meetings with a physician. And they're not available. So they have to go
Yeah.
elsewhere and spend even more money on top of everything else that they have to do in
Right.
order to get the education. And so we, at Jumpstart Psych, I think more than anyone, is we focus on what is going to get you results clinically. We don't waste any time with theory, with chin scratching. Oh, that's so interesting. Tell me more. No, it's
Yeah.
you have a patient, there's you, and what are you going to do in a given scenario using a specific type of modality. Yeah. Thank you, Andrea.
One thing I would add to is I think it also, in my mind, adds a little bit more of like a legal protection, in a sense. Just, I know, as a nurse practitioner, we're able to provide therapy, right? However, it's like, should that ever be called into question in like what I'm doing in my sessions or anything like that? Like, I have this framework and I can go back to it and I can be like, listen, I did this much on top of what is minimum requirements to be a mental health nurse practitioner. I've had this extra didactic hours. I've had these extra experiential hours. I've had these case consultation hours. I have this ongoing supervision hours. And I think it just provides me with a sense of, maybe it's false security, but security in what I'm providing to people too. Yeah. I think that's another thing that I would add to that.
Yeah, like you have, not only is it your confidence in knowing that the interventions you're doing psychologically are evidence-based, but when you're billing to insurance companies, because you said you're in network, you actually have a framework to base your billing off of evidence. And also you're supporting the patient in very clear, identifiable ways, as opposed to just being a nice person and saying nice things. Now, instead of just being a nice person, now you recognize, oh, I'm actually doing therapy. And that's the difference between being a nice person and doing therapy is. And you have that very clearly outlined in your mind. And that feels very safe for you.
Yeah. Yeah.
Very cool. Is there anything else that you feel like is important that you haven't talked about?
I don't know, just that, you and Dr. Opler and Dr. Tetchell are great. I've enjoyed working with every one of you, and I feel like you all add a little bit different different styles, different takes on things. And so, I think I think this is a really high yield program, high yield supervision as well. And I would recommend it.
Thank you, Andrea. We appreciate that. And would you like to share with everyone what it is that you're up to, maybe about your private practice or any of your side projects that you're working on?
Yeah. So right now I am working on developing a course. This first course that I'm developing was geared more towards nurses and nurse practitioners. And this is really on how to establish a personalized prevention plan for your own mental health. Again, I told you kind of my passion is in prevention.
Mhm.
And so I actually released a free PDF guide to help people get started on prevention planning. But
How can they get access to
prevention
that?
planning, what's that?
How can they get access to that?
You can follow me on Instagram at Floss Mental Health, and there's a link in the bio there that you could go and download that. My intention is that I'll eventually get those out for different professions, first responders, law enforcement, teachers. Again, I like caring for those that are really serving the public. And so that is kind of what I'm up to right now. If you want to learn more about what prevention looks like, what prevention is. Prevention isn't just for people that have never experienced any mental health issues. It can be for anyone. So.
Yeah, because everyone has mental health, no matter
right.
how old or how young you are, or how smart, or how intellectual you are. Everyone's got mental health. It doesn't matter who you are.
Yes, and mental health is a continuum, and it doesn't always have to be pathologized. So.
Right. There's varying degrees, right? And if anyone wanted to work with you one-on-one as their psychiatric clinician, how would you recommend them to schedule an appointment with you, or to reach out to you in that respect?
The easiest way to reach out to me is through my website, www.flossmentalhealth.com. You can either go through the contact me page, or if you are interested in an appointment, you can do a little new patient inquiry form on there.
So. And you're licensed in which states? I think in multiple, right?
No, I am just licensed in Oregon. So you do have to live in Oregon for me to be able to work with you at this time. Which is another reason why I'm trying to work more on some different classes and maybe workshops and stuff, so that it allows me to disseminate some of this knowledge with others, where I'm not necessarily working directly with them, but I can disseminate it to others in different states and stuff as well. So.
Nice. Well, keep up the great work, Andrea. I always love chatting with you. I love seeing you in supervision. I just think you're such an excellent provider, and I think I've actually watched you grow from coming into the program and where you are now, and I'm just over the moon happy for you. And thank you for sharing such glowing feedback for us. It really means a lot to us.
Yeah, no, thanks for having me.
Talk to you soon, Andrea.
All right, bye.